All right, diving right in today. GLP-1 RAs. And is there really a connection to thyroid cancer?
Yeah,
That seems to be what everybody's talking about.
it is.
So we're going to take a look at a medical case study. We got some research articles, and we're going to bring in this recent piece from JAMA
Okay.
and see if we can't figure out what's going on, what it means for everybody listening.
Yeah, I mean, especially since these medications have just become so popular.
Yeah.
I mean, for treating type 2 diabetes and obesity.
Right. I mean, you hear these names all the time now.
Yeah.
Like maglutide,
Yes.
liraglutide, dulaglutide. They're like household names now. And of course, tirzepatide.
Yes.
But this thyroid cancer thing, it's kind of put a damper on things.
It has. And that's why there's this black box warning now. It's basically a heads up for doctors and patients to, be extra cautious.
Yeah. So where does this concern even come from? I mean, what's the evidence?
Well, it really started with studies in rodents, and they were showing a pretty strong connection between GLP-1 RAs and medullary thyroid cancer, MTC.
Rodents. How much can we really learn from rodents about, what's going on in humans?
Right. That's the big question.
Yeah.
Rodents have a lot more C cells in their thyroid glands than, humans and primates do.
Right.
And these C cells are the ones that can actually become cancerous and develop into MTC.
So maybe they just, I don't know, maybe GLP-1 RAs just interact differently with rodent thyroids because there's more of those C cells around.
That's exactly it. You can't really compare them directly.
Right.
And it's even more interesting because studies in monkeys, which are a lot closer to us, haven't shown that same strong connection.
Okay. So the rodent studies are raising a flag, but maybe not the whole story. What about the human studies? What are they telling us?
Well, they've kind of been all over the place. I mean, a 2024 study in diabetes care found that long-term use of GLP-1 RAs, like 1 to 3 years, was linked with an increased risk of different types of thyroid tumors. But then there's another study from the same year. This one was in JAMA Otolaryngology Head and Neck Surgery, and that one said the increased risk was only in the first year after starting a GLP-1 RA.
Wait, so one saying the longer you're on it, the higher the risk. The other one saying only in the first year. I mean, what do we make of that?
Yeah, it really just goes to show how much more we still have to learn.
Well,
The authors of the JAMA study actually think that this jump at the beginning might be because of increased surveillance and early detection, not necessarily the drug itself. Like, if you start a new medication and your doctor's checking your thyroid really closely, they're going to find any problem a lot sooner.
so it might not be that the drug's causing more cancer, but the doctors are finding it sooner because they're looking for it.
Exactly. And then to make it even more, interesting, a study in 2023 from Korea found there was no difference in thyroid cancer risk between the patients who were taking GLP-1 RAs and those using other diabetes medications.
Okay, so we got rodents making a lot of noise, monkeys not so much.
Right.
Human studies are all over the place.
Yeah.
Sounds like the risk, if there is a risk, it's concentrated in that first year maybe because of all that extra attention. But even then, it sounds like the overall risk is pretty low. I mean, for the listener here, what's the bottom line?
Well, you definitely shouldn't just write these medications off, but it's certainly something to be aware of. And, talk to your doctor about it.
Speaking of specific cases, we got that medical case study you mentioned earlier from the Journal of the Endocrine Society. That one sounds a little outside the norm, which is always interesting.
It is an interesting one. So there's this 51-year-old woman who develops MTC while she's taking a GLP-1 RA. But what's really different about this case is that she has this unusual mutation in a gene called RET.
All right, no geneticist here.
Right.
What's this RET gene all about? And why is this mutation so important?
Okay, so RET is an oncogene. And what that means is it's a gene that regulates cell growth. And when oncogenes mutate, they can get overactive, which means uncontrolled growth or cancer. And the RET gene specifically, we know it increases the risk of endocrine cancers, like MTC.
So this woman, she's already predisposed to MTC.
Right.
And then she starts taking the GLP-1 RA. Is that what we're looking at?
That's it. It's the first case we've seen that links this specific RET mutation to MTC in a patient who's taking a GLP-1 RA. Now, it is just one case, so you can't really make any broad conclusions from it, but it does bring up some interesting questions.
Like, are people with certain mutations more susceptible to developing this thyroid cancer if they're taking GLP-1 RAs?
Exactly. It's something that needs more investigation. It just goes to show that we need to keep researching how genetics and this GLP-1 RA use, how they might connect.
So we got all these mixed messages from all the research, and then this case study throws, another wrench into the works. Before we get into what all this means for the listener and what kind of precautions people should be taking, let's talk about calcitonin, because it keeps coming up.
Okay.
Right. So calcitonin is a hormone that those C cells we talked about earlier, that's what they make, and it's used as a biomarker for MTC. So basically, if your calcitonin levels are high, that could be a red flag.
And, I mean, the rodent studies showed GLP-1 RAs can cause those calcitonin levels to go up, right? Doesn't that mean it's stimulating those C cells and possibly increasing their risk?
Well, not so fast,
Mm-hmm.
because even though we see that in rodents, human studies have shown that long-term use of GLP-1 RAs, their calcitonin levels didn't really go up significantly.
So another disconnect between what's happening in rodents and
Exactly.
what's going on with humans. A lot to unpack here.
There is.
Shows how much we still need to learn about the long-term effects.
Absolutely.
I mean, science is a process.
It is, and that's what makes it so exciting.
Right.
But speaking of figuring things out, I'm sure the listeners out there are saying, okay, but if I'm taking this GLP-1 RA, what do I need to do to make sure I'm being, as safe as possible?
Yeah, that's a great question. And that's exactly what we're going to get into after, well, not after anything. We're just going to keep going. We'll look at some practical steps that you can take to stay on top of things and be proactive about your health. So stay with us.
Absolutely.
Yeah.
Stay tuned. Stay right here.
Mm-hmm.
So before we got sidetracked there, we were talking about calcitonin and how it's used as a marker for MTC. And we were trying to kind of figure out how those rodent studies where GLP-1 RAs seem to raise calcitonin levels.
Right.
How does that line up with the human studies that aren't showing the same thing?
Yeah. And I think it comes back to, how different these species really are. Rodents are super useful in research, but they're not, a perfect stand-in for human biology. It's entirely possible that those calcitonin increases they see in rodents, that's just, their physiology.
So are we just throwing out the rodent studies then? I mean, are they useless?
No, they're still useful. We just have to be, we got to be careful how we interpret those findings.
Mm-hmm.
It's like, well, think about it. Like you're trying to understand a really complex machine,
Okay.
and you're looking at a simplified diagram.
Right.
The diagram can give you the basics, but it's never going to show you every little detail, every nuance.
I like that. So we got to remember that what we see in rodents might not always be exactly what's happening in humans.
Exactly.
Which brings us back to the listener. If they're prescribed a GLP-1 RA, what precautions should they be taking? We've talked about, talking to their doctor, regular thyroid checks.
Right.
But is there anything else they can do to stay on top of this?
Well, one thing that's really important to remember is lifestyle.
Oh, okay.
Because lifestyle factors, those can really play a big part in thyroid health.
It's interesting.
Maintaining a healthy weight, eating a balanced diet, managing stress.
Right.
All those things contribute to just overall endocrine well-being.
So it's really about like a holistic approach, right? Not just focusing on the medication itself, but like looking at your whole health picture.
Exactly. It's really about you taking control, being an active part of your own healthcare, not just letting things happen.
Right. And speaking of being proactive, it sounds like, we've looked at a lot of research, but there's still a lot we don't know about these long-term effects of GLP-1 RAs. What kind of research is still needed to get, a clearer picture?
I think we really need more large-scale, long-term studies, studies that follow these patients who are taking GLP-1 RAs for a really long time. That way we can see how often thyroid cancer is happening, what other side effects might come up, get a more accurate idea.
And it seems like genetic research is probably going to be really important too, right?
Absolutely, because, the more we learn about the human genome, we're starting to see how all these little genetic differences, they can affect how people respond to different medications.
Yeah.
So research into, how specific genes might interact with GLP-1 RAs, that could help us figure out, which patients might be at higher risk for certain side effects.
That would be amazing.
Yeah.
That way we could really tailor the treatments.
Yes.
For each individual person.
Exactly. It's all about personalized medicine.
Yeah.
Taking into account each person's genes, their medical history, their lifestyle.
Okay, so, wow, we've covered a lot of ground today.
We have.
Rodent studies, human trials, case studies, genetics. It's a lot.
It is. And I think what's important to remember is science is always changing.
Yeah.
What we know today could be different tomorrow as we get new evidence.
So for our listener, let's try and distill all this down. What are the key takeaways?
Okay, so the big one is The absolute risk of developing thyroid cancer while you're taking a GLP-1 RA, that's considered low,
Yeah.
but you still need to be aware of that risk, and you need to talk to your doctor about it.
Definitely.
Okay, second takeaway. If you are taking one of these GLP-1 RAs, you need to get those regular thyroid checks.
Super important for early detection.
Absolutely. And third, don't discount those lifestyle factors.
Right.
Healthy weight, balanced diet, stress management, all of those things can contribute to overall endocrine health, including your thyroid.
All great points to keep in mind. But before we wrap this up, I want to go back to something you mentioned earlier.
Okay.
This idea that some of those increased thyroid cancer diagnoses, maybe it's not the drugs themselves. Maybe it's just increased vigilance,
Right.
more early detection. Can you expand on that a little bit?
Sure. So when a new drug comes out, especially one that's gotten attention for, potential side effects,
Right.
doctors, naturally, they get more cautious.
Makes sense.
And so they might order more tests,
Mm-hmm.
more screenings,
Oh, yeah.
and that can lead to them finding cancers that they might not have even noticed before.
So it might not be that the drug is causing more cancer, but we're just finding it sooner because we're looking harder.
Exactly. And this is, it's called surveillance bias. And it shows how important those long-term studies are.
Right.
Because if a drug is truly increasing the risk,
Right.
we'll see that over the long term, not just, right after it's introduced.
So we got to separate the signal from the noise. The initial spike, that might be noise.
Right.
But the true signal, if there is one, that's going to show up over time.
Exactly. And that's why we need to keep researching this. We need to keep track of the long-term effects of these GLP-1 RAs and make sure that, make sure the benefits outweigh any potential risks.
Right. Okay. Well, sounds like we're about ready to wrap up this deep dive. Is there a final thought you want to leave our listener with?
Sure. I think the most important thing to remember here is, the human body. It's incredibly complex.
Oh, yeah.
All these systems are interconnected, and what affects one part can have, ripple effects everywhere.
Right.
So as we're getting all these new medical advancements, it's great to be excited about them, but we also got to approach them with, a healthy dose of caution.
I love that. I love that. Great point to end on. Stay curious, stay informed, and keep those conversations going with your healthcare provider. Until next time, happy diving. Okay, so we have really gone deep, haven't we?
We have.
On GLP-1 RAs
Yeah.
and their connection to thyroid cancer. We've looked at all this evidence, it's a bit mixed, and we talk about genetics and more research that we need, and even how, doctors themselves they
Right.
might be skewing the data a little bit just by looking more closely.
Yeah. You've been really paying attention. It's really great to see such an engaged listener.
Well, I'm just trying to follow along with you. But speaking of keeping up, I think there's this one big question that everyone listening probably has after all this back and forth. I mean, are the benefits of GLP-1 RAs, are they really worth the potential risks?
Yeah, that's a tough one.
Right.
It is. And to be honest, it's not a question I can answer for anybody. It's really a personal decision
Right.
that you need to make with your doctor.
But we can at least talk about those benefits. I mean, these medications, for a lot of people,
Oh, yeah.
they've been pretty amazing.
They have. GLP-1 RAs, they're really good at, lowering blood sugar, improving insulin sensitivity, helping people lose weight. They can even lower the risk of heart disease and stroke. And those are big problems for people with diabetes.
So for a lot of people, those benefits, they might outweigh the risk of thyroid cancer, which, we've said it's relatively low, especially since, we've got early detection and treatment options.
Yeah. Yeah. That's a good way of looking at it. It's all about, kind of weighing the pros and cons and then making an informed decision based on your own situation, your risk factors.
And that's why it's so important to talk to your doctor.
Mm-hmm.
Be open and honest with them. They can help you figure all this out because it is complex.
Yeah, it is. And, if we zoom out a little bit, if we look at this from, a bigger medical perspective, I think it's important to remember that all medications, they have the potential for side effects. There's always this balance, right, between what we gain and the risks. The key is, to know what those risks are and to have a doctor, a healthcare provider that you trust, to help you, to guide you through all of that.
And that's something everyone can take away from this, this whole deep dive. Be an informed patient. Be involved.
Yes.
Do your research. Ask questions. Advocate for yourself.
Thinking about all this brings up another interesting point. We've been, really focused on GLP-1 RAs and thyroid cancer. But it makes me wonder, how do we as patients, how do we deal with all these new medical discoveries all the time and all these potential risks that come with them? How do we learn to, how do we get better at understanding medical information, especially now when there are so many possibilities and so much that we don't know?
That's a really great question to think about, and I think that's the perfect place to leave things today. We hope that this deep dive has given you all the information and maybe some new perspectives, to help you talk to your doctor. Remember, it's your health.
Yeah.
You deserve to be a part of all the decisions that affect it. Until next time, stay curious, stay informed, and happy diving.